to the Beverly Hills Plastic Surgery Podcast. I'm Dr. J. Calvert, and I am here in Beverly Hills with my co-host, Dr. Millicent Rovelo. How you doing, Millicent?
Good evening. I'm doing well. How are you?
I'm doing great. I'm here to talk to you about getting red carpet ready.
Red carpet ready.
From a plastic surgical standpoint, of course.
Right, of course. But to be fair, we are in Los Angeles and it is red carpet season. Award season is on us. And you know how I know this? Because my commute home on a Friday evening is about twice as long as it should be.
That's right. You have to go through the Golden Globes were over here.
They were over here, yeah, in
Right.
Santa Monica.
They were right here at the Beverly Hilton.
Yes.
But yeah, going back through all, it's coming.
Hollywood Boulevard, Sunset, they just shut down. I'm like, oh, must be award season.
It is.
Yeah.
So getting red carpet ready, so not everybody's from Los Angeles, so they don't get this, there are red carpets outside of restaurants sometimes when they introduce a new dish.
That's
Red
true.
carpet is overused a little bit. But the big red carpets that we're talking about, the next big one coming up is the Oscars, or is it the SAG Awards?
I think it's the SAG.
SAG Awards.
Yeah.
So this is a big deal because you want to look your best. The photographs and the publicity and it's nuts what goes on.
It's nuts. And so we're calling it red carpet ready, but really this is for anybody that has a big event coming up. So it could be a wedding, a reunion, a graduation party, something that you know is coming and you have time to prepare for it. What do you need to do to get ready?
Well, that's true. And then there are, of course, levels of getting ready.
Oh, yeah, there are levels, and we will go through the levels. Right.
So there's the concept that, okay, I have a big event coming. Let's say you are the nominee for best musical score in a film or whatever. So you're going to be nominated. You have to go to the award, and you may not win. You may win. So the camera's going to definitely be on you when they say
Right.
What do you pay attention to the most? Is it your body? Is it your face? Is it your skin? Is it your look? Never mind the clothing and all that. That's a whole nother.
Oh, yeah.
That's not even our podcast. Look at us. We're in scrubs. We're doing our best here. But let's talk about your face first, because that's really where the action is. When you're being interviewed, we're sitting here and the camera's on us, we just came from clinics and seeing patients and all that. We didn't get red carpet ready for this one.
Right.
But if you're going to be on those big HD cameras with all those lights, what do you think of first?
So this is where I think your gender is showing, because I would argue that it's face and body. Because if you're putting on that form-fitting dress,
I don't have to wear one of those.
Looking not just at your face, let me tell you.
That is true.
So I will beg to differ with you a little bit there. So I think
my gender is showing, as a matter of fact. Sorry. Just thank you for letting me know.
No comment. But no, to be fair, I think we should talk about everything, because I think it really is everything. This is why brides lose, the 10, 15 pounds or whatever they do before their wedding, because it's the whole picture. And yes, the HD cameras certainly don't help. That's just
guys have it easy. We can totally get away with it. You slap a suit on, put on a tie.
Hides all manner of evils.
Yeah, you can get away with anything as a dude. But you're right. The women come in, dresses that barely cover anything, and they are form fitting. That is very key. Yeah. So let's start with the body then.
Let's start with the body, because I think that's going to take the most amount of time to really get ready. So there is the prerequisite. You got to eat healthy and diet and exercise. There's all those things that you have to do.
Okay, so we're not going to do that. Now what?
But if you don't want to do that, or assuming you're already doing that, what else can you do? And I think probably if you're really planning ahead and you're at your goal weight and you know that there's just some areas of your body that need a little bit of extra help, that's where you could consider options like some kind of non-invasive body tightening procedure, or my favorite would be liposuction. Little small areas that just need a little bit of tweaking to get you really red carpet, camera ready in that tight dress.
No, and you can do lipo, especially if you do the laser lipo. I will mention that I am a consultant for all the lasers, but the laser lipo tightens the skin, so you can do that 6 weeks before, or even 4 weeks would be pushing it.
Yeah.
6 to 8 weeks before liposuction's not out of the question.
It's not, and I would say, yeah, 6 to 8 weeks. The thing is, with depending on how much you do, but generally speaking, a small to moderate amount of liposuction, you're going to be swollen for a good 4 to 6 weeks. So
That's right.
6 weeks is what I tell everybody. If you're thinking of getting any kind of liposuction before a big procedure, I would give it at least 6 weeks, more if you can, because you never know if there's going to be a little hiccup somewhere here or there. But at
You mean
least
before like a big event? You
before
said
a big
before a
event.
big procedure.
Oh, sorry, no.
That's because you're going to do a big procedure.
No, I'm sorry, before a
That's
big
what we
event.
do. We have to get
Yeah.
ready before our operations. I want to look good for this
I look
operation.
really good.
When I do this facelift, I got to lose like 10 pounds.
So that's where I would say, starting with the body, once you've sort of done your goal diet, exercise, liposuction, if you're going to do it, 6 weeks before. Then moving on up.
Well, what else then? Is there time to do like a breast augmentation or breast lift? What if you want to
Sure.
spruce up the upper pole here?
I would say if you're looking to do a breast augmentation, 8 weeks maybe before.
Yeah, because I typically think it takes 3 months for
Yeah,
implants
it
to
is.
settle.
They really do. 6 weeks you're healed. I don't take pictures at all of my patients before 3 months. Because those
So you need
implants
a little
are
more
still
time on that.
sitting really high.
Yeah, they can sit high, and
Yeah.
that's not
And then
good.
all of a sudden everyone's in the news and commenting on did she not get a breast implant, because they're artificial looking for a little while. Or for
Yeah.
a long while,
Well, I've
depending
had
on
plenty
what
of
you've done.
commentary on my patients. It's like, yes, she should say, yes, I did, and it's J. Calvert, but they don't say that.
No.
They just go, wouldn't you like to know? No.
Yeah.
It's really, like my dentist. Have I talked about my dentist
No,
before?
not yet.
So my dentist, who is amazing, John Marashi, he's in Brentwood. He has signed magazine covers from his patients. Like, his patients will not only admit that they've had dental work by him, but they celebrate it.
They sign off
They
on
bring
it.
him framed photos of the requirement, he says, anybody can be on the Wall of Fame. You just need a magazine cover with you on it. And then you can get on the Wall of Fame. Tom Hanks, Matt Damon, Ben Affleck, he's got Jada Pinkett Smith. He's got all these people like on the wall. Sign up. Thanks for the great team, John. Like, can you imagine if we had that in here?
Oh, that would not fly.
Never, not in 100 years.
No, we'd be sued.
The HIPAA police would come in here. Not only would they sue us, they'd probably just shoot us on sight.
Yeah. No,
But
for
you
sure.
can't do that here.
No, you can't say that.
So nobody wants to talk about it. Nobody wants to talk about their facelift. Nobody wants to talk about their breast augmentation. They just like to get it and then go on the red carpet and be like, oh, don't I look amazing?
Yeah, it's, diet, exercise, and green juice help my boobs grow.
They should be like, oh, and who are you wearing? Dr. Millicent Rovelo,
Yeah. No,
Allergan,
for sure.
or you like Sientra. So Sientra 550s.
That's what I got.
That's
Yeah.
right.
No, that's never gonna happen.
No, never. Never. It's never going to happen. Oh, and my hair was done by so-and-so, and then I had the, they'll rattle off everything except
Their
their
plastic
plastic
surgeon.
surgeon.
Yeah.
It's the worst.
Well, I'd rather be the unknown plastic surgeon who did a good job than the one that's blasted everywhere for botching something.
Well, that's true.
So I'm okay with being unknown
That's
in that
true.
regard.
Yeah, well, I have a lot of patients I'd really love to, like, shout from the rooftops, but I can't. I just have to sit here and take it. But they do refer, so that's okay. I mean, I have to say, my known patients are really good about referring, even though, in fact, I had a referral today that's so funny how it happened, but it's like, it turns out that this patient completely knew me and went to like this like known person who I operated. It's like, do you have any recommendations for a plastic surgeon? And she was like, well, don't say anything, but this is the guy.
Yeah.
And she was like, really? My kid goes to school with his kid. I was like,
Like that guy?
and she was like, yeah, that guy. And she's like, oh, okay. She's like, well, he did this and this and this, and she was like, I guess I'll go there then. It was like
That's
it was
pretty
very
cool.
it was very random. Like
That's
that
cool.
that comes up. But anyway, back to the red carpet ready thing. Breast augmentation 90 days, liposuction 6 to 8 weeks. What else are you gonna do before the red carpet? Facelift?
Ooh, that's a bigger planning one.
It's
I
your
think.
first nomination. Like, what if this is the first nomination and you need to look awesome?
I would say you got to give that a good 6 to 8
Yeah, I would say a year.
A year?
6 to 8 months.
Yeah.
Red carpet ready, facelift, 6 to 8 months.
Yeah, I think that's reasonable.
You can pull it off in a short period of time if you're really good with the makeup.
I was gonna say, you have to do the makeup.
You can do it.
Yeah, because the swelling really, the swelling will be done, the scars will be a little visible, but again, makeup can cover a lot of that.
I think I facelifted somebody 2 months before an event.
I think it's doable.
I think I did facelift
really
somebody 2 months before an event.
Yeah.
And she was fine.
Yeah. It's depending on how you do it, it could be a very dramatic change. After the facelift has been in place for 6 months, 12 months, it gets a little more natural, worn in looking. A fresh facelift is kind of obvious.
It is, and that's the thing. I mean, what if you have a problem? I mean, complications happen in surgery.
Right.
We are not sitting here saying like, oh, we never have complications. But, we don't have them often, but when we do, that could be a massive setback.
The recovery can definitely be longer.
Totally.
So something to definitely think about when you're talking about surgery in preparation.
Surgery is a whole different animal.
Yeah.
Okay. Face. Lasers.
So lasers. So we can do a whole podcast on lasers.
We will.
But really the whole idea of most lasers is to rejuvenate the face. And you can do that in several different ways, whether it's through light-based photofacials or a more intense ablative laser like a pixel or a CO2
erbium or CO2.
And really, depending on how aggressive laser you're doing, if you're doing a full, aggressive ablative laser, you really need at least 8 weeks, I would say.
I agree.
Before going out and trying to be camera ready. If you're doing one of the lighter ones, like the pixel ones that we have here, a week or two is probably fine. But
2 weeks.
The thing with all of the 2 weeks. The thing with all of the lasers, like the photofacials or the pixel lasers, a lot of times you have to do a couple of treatments to really see a full effect. Aside from the CO2 laser, which is going to have a massive effect immediately, a lot of them require a couple of sessions to really get the best result. And you're looking at 2, 3, 4 sessions of treatments spaced 4 to 6 weeks apart.
I agree. I mean, I think for the pixel, though, with one pixel you can get nice results. You can really calm down the sun damage. You can get a good, and there's something that I do that you would probably like, is this, I turn the pixel down to a sort of a non-ablative setting, but it's still pretty strong, and I do what's called a laser facial.
Oh yeah.
And it's really nice.
Yeah.
And that is something like if you show up 5 days before, what do I do? A laser facial does it. You just turn it down. I remember we did an Oscars spa in 2006 or something, long ago. And I did laser facials on everybody that was going to the Oscars, and it was really cool.
That is cool.
And they liked it, and they really felt like it made a big difference just for getting things activated so that the makeup takes better. It's just,
it does.
It gets
refreshes.
things moving.
It's like a nice exfoliation. You get the dead skin cells off. You get a glow to you from those newer skin cells coming up, and it's very refreshing look.
Lip fillers.
You got to give that a few weeks, I would say.
Totally.
You got to give it a few weeks because lip fillers are great, but you can bruise. Not all the time, but you can bruise. And those bruises can take a while, 1 to 2 weeks in the lips for the bruising to go away. And the swelling, I'd say most of the swelling will probably be done by about 2 weeks. But again, same thing as with surgery. There may be little revisions, like one side might be a little more asymmetric than the other. Or maybe you went too big and you don't like it and you want a little bit of a reversal. So same thing. If I'm doing fillers personally on myself before an event, I like to do it at least a month before.
You do fillers on yourself?
I do. I do.
What's wrong with me? Where did I miss this,
I laser myself, I filler myself,
oh, that's good.
myself.
Good for you.
But yes, I would try to do it a good month before. That way if there's any little tweaking that I need to do, I can do that a couple weeks before.
So for those of you who cannot laser yourself or filler yourself, we think that you should probably come in for 6 to 8 weeks before.
Yeah,
I think
for
so.
sure.
Yeah, because lip fillers are big. The other thing that I wound up doing for some people is if they have these really thin earlobes and they want to wear these gargantuan rings, you can put some Restylane or something into the lobes so that it can support the earring, a little bit more. That's a nice thing to do.
That's good. And then any other fillers in general, fillers that you want to do for lines or for, plumping up of the cheekbones or anything like that, I think it's similar, 3 weeks before. There's going to be some bruising, not to the degree in the lips. Those areas of the face are a little bit more forgiving should there be any asymmetries. But yeah, I would say a good 3 to 4 weeks with the fillers, for sure.
Rhinoplasty before the red carpet?
Let's just stay with the injectables for now. Botox. So Botox.
Yeah, you could get Botox. You could get injectable filler for your nose.
That's true.
If you want to push the tip up a little bit of filler in the columella. You want to fill in some dents or divots. You can do that. Some filler in the nose, but non-surgical rhinoplasty.
Right. But then I think something like Botox. Botox takes at least a week, up to 2 weeks to have a full effect.
2 weeks, I think.
I think 2 weeks for the Botox. Again, a little bit more, just in case you need a little touch up. Nobody wants to be that person on the red carpet who has one eyebrow, cocked up.
Except for Leonard Nimoy, Mr. Spock.
Oh yes, then he would love that. But
or The Rock. The Rock has that one eyebrow
That's
thing. He can
true.
do that.
Yeah.
But you don't want to look like him.
No, it's not a look for everyone.
On purpose. That's true. Yeah, but Botox is a great red carpet thing. And then also your skincare regimen. Obviously, I think you should get a hydrofacial.
For sure.
Of course, this podcast is sponsored by Rock Spa, so it's right here. Come get your hydrofacial. It's amazing. I think that really changes the game on your skin.
No, I 100% agree. So I think if you're looking at your skin and you have the time, you're doing your sessions of lasers, whatever that is. If you're looking at skin damage, then you're doing, your photofacials or a light ablative laser. The resurfacing for coarseness or fine lines, you're looking at those months ahead of time to get that lined up. Then as you're getting closer to that month before your event, that's your fillers and your Botox. But then as you come into that last week of your preparations, and that's when I think hydrofacials or any kind of facial are pretty good. I like the hydrofacial probably the day before maybe. It just gives you this really dewy, glowy, plumped up, clean skin.
It's awesome.
Yeah.
The hydrofacial is amazing. I love that machine.
Right, and there's not really any downtime to it. You look great. You look glowy.
I want to mention that we are not sponsored by Hydrofacial, but we're willing to be.
1,000% willing.
So I'm just gonna put that out there. All right. Well, that sounds like a plan. I think we've kind of covered it on the red carpet, and of course, learn how to smile. It's amazing how many people don't know how to smile for the camera.
It takes practice. It's not
easy.
You gotta be okay with getting in front of your mirror and posing.
Gotta practice.
You gotta do the over the shoulder look. You gotta check out your butt in the mirror. You gotta do the face,
Absolutely.
the smile.
That's what I do. I check out my butt. But no, you do. You have to you really have to give it a, it's not enough to just look great. You have to be able to work the red carpet.
It's a skill.
It is. And there are certain people who know how to do it, and they make it awesome. And I've been to that American Music Awards red carpet 2 years in a row now, and it's interesting. You see who gets it and who is just totally uncomfortable, and they're like, "Get me out of here."
It's not for everyone.
No, it's not.
Not everyone is.
Especially the musicians.
Awkward.
That's not their thing.
Yeah, that's not what they do.
Not at all. But and then you have the actors. Of course, they're actors. They know how to do this. This is their
That's
thing.
their job. That's right.
But then you get the directors and the
the
other
off-camera
folks,
people,
and they're like,
right.
it's really,
It's
tough.
Yeah.
Not easy. Do you think that there's a red carpet in the future for the Beverly Hills Plastic Surgery podcast?
I certainly hope so.
Is there
That'd
a
be fun.
podcast red carpet that we could be on?
I'm sure there's some podcast awards somewhere.
There should
There
be.
are, actually, I think there are.
Are there?
Yeah. So maybe one of these days we'll be doing our own
Here we are.
podcast.
We're right here.
Red carpet.
We're ready. That's right. We'll do our own awards. This is how you get ready for the. Mine will be like, I wash my face, brush my hair, and I put on the suit. That's it for. I'm telling you, I'm awful with that stuff.
I will be the 6 month.
Yeah, you
I'm
can
on the
do it on the
6 month
6 month plan. That's right.
But
We'll do every operation that we possibly
Very
can.
What we did not talk about, I think, and we usually are pretty good about talking about this. Let's talk about the cost of getting red carpet ready, because it's very easy to say,
That's right.
oh, get your liposuction, get your breast dye, do your laser
that's true.
facials. But there's
Crack
a
open your
very
wallet and
distinct
get ready to be
cost
upset.
to this. Yes. So let's get real about that.
Okay, let's talk about it. Liposuction is going to be, if you're doing abdomen and flanks and thighs, which is probably the most likely for a form-fitting lady dress, gown, you're talking about $15,000 in Beverly Hills, probably $10,000 elsewhere.
Depending on the areas, 8, 10, something like
Somewhere
that.
in there. If you're doing fillers, let's talk about fillers because that's probably one of the more common things. You're looking at $600, $700 a syringe, depending on the filler.
Right.
Probably I don't know if it's less elsewhere because the prices are the prices.
Prices are pretty much set by the companies. So fillers are sold by syringes. And if you're doing your lips, you're looking at probably 1 syringe. If you're doing your cheeks, you're looking at another 1 to 2 syringes. If you're doing other fine lines. So depending on how much filler you're doing, anywhere between 1 to 3 syringes. Each syringe costs between $650 and $1,000.
Yeah.
So you're looking at
using Voluma, that's expensive.
a couple thousand. Botox ranges, it's sold by. We've had this discussion.
But it's going to be check.
You're gonna
we're going to refer
4 to
you to What's with the Botox, former podcast of ours.
I would say you're looking at anywhere between $400 to $700 with the Botox.
True.
And then the lasers. Lasers can be quite expensive.
Anywhere from $800, $1,500 up to even $3,000.
Yeah, depending on how many sessions you do.
And each laser has a different cost.
Yeah.
Breast augmentation, very variable depending on what you need. It could be anywhere from $10,000 to $15,000. If you're elsewhere in the country, it could be $6,000, $7,000 to $10,000.
And that's for we're not doing the breast one. That's a primary breast augmentation. If you're talking about revising the breast or doing a lift or fat grafting, the numbers can certainly get much higher. And then your facelift. You throw a facelift on top of that, maybe a rhinoplasty.
Facelifts are expensive. Facelifts in Beverly Hills range from like $15,000 to there's a guy that charges $100,000.
Yeah.
They can be really expensive. I think in the national average for a facelift, that's face and neck only, is probably $12,000. The cost around here is probably, average cost is probably double that, maybe a little more. And then if you're doing eyes and brow and all that, the prices go up from there.
Yep.
Not cheap.
Not cheap, but if you can swing it, it's worth it.
And evidently there is no gym for your face. So this is the only way you're going to get that stuff rejuvenated.
No, I just drink lots of water, I juice, I do yoga, and I just woke up looking like this.
That's right. That's exactly how it happened. Just a lot of green juice. Kombucha on tap, that's really important to me.
Get lots of 8 hours of sleep. Lie. Lie.
That's right, then that's what happens. It's just, that's how it goes. Well, I think that's it. So crack open your wallet, get ready, and start thinking about your red carpet 6 months before.
Absolutely, at least 6 months before.
And we think you should brag on your plastic surgeons. We
Please.
want to start a new trend.
We want a shout out.
We want a new trend on the red carpet. You know who you are. That you should be adding to that list of everybody who got you ready to, and my plastic surgeon is so-and-so. I would love to hear what I'm doing.
Love that. Just pure honesty would be so nice. So refreshing.
It's not going to happen.
No.
I've never had any plastic surgery. What are you talking about? Well, anyway, that's us. That's the red carpet story from Dr. Rovelo and me, Dr. J. Calvert. And this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.